Doctor, thank you. How concerned are you about this rise of the UK variant in children, especially considering they likely won't be able to be vaccinated until the fall at the earliest?
Yeah, Shep, thanks for having me on. I am concerned. You know, the B117, that UK variant, is more contagious in everybody, in adults and kids. So it makes sense that we're seeing a bump in infections in children. And we're not seeing a lot of infections in older people because we're getting them vaccinated. And that really leaves young adults and kids vulnerable to B117. One of the reasons we can't totally relax right now is we've got to really bring these infection numbers down.
You know, we've been hearing from the very beginning. I can remember in the early going, leaving packages outside in the sun or wiping stuff down from UPS and then not touching. Now the CDC says, forget about all that wiping stuff down. That's not a thing. Why so late in telling us this?
Yeah, it's late. It's late. I think by last April, May, it was very clear. Look, in the first month, we didn't know. I think it's pretty reasonable, right? When you don't know.
It was clear last April or May. That's a year ago, and they're just now telling us? I mean, what are they? What do they own stock in Clorox? I mean, seriously.
You know, it's incredibly frustrating. I think I was starting to say by last April, May, many of us in public health, stop wiping down surfaces. I mean, look, basic hand hygiene is really important. A little wipe down is fine. But let's not obsess. Let's not wipe down groceries. That really, I stopped doing it, stopped recommending people doing it. I don't understand actually what took CDC so long to really be clear about this. This virus is spread through the air. It is not spread through surfaces largely. And we've got to focus on keeping the air clean.
Yeah, well, if they wait this long to tell us that, can you really blame people who don't think that much of this whole situation in the first place for going, I don't need that mask? I mean, the high and mighties complaining about what's going on with the Texas Rangers yesterday. Oh, you know, spreader. How are we to know in a few months they won't say those masks weren't even necessary? I mean, you know the difference, but I mean, does everybody else?
Yeah, I know it's frustrating. And this is why I think clear public health messaging in this pandemic has been so important. And it has not been there. I would say, look, again, the first couple of months, confusing. By April, May last year, it was very clear this is airborne. Masks are really important. Good ventilation is important. Outside is better than inside. Surface is not a big deal. I've been repeating that message for close to a year. I think a lot of public health people have. It has been frustrating that hasn't always come out consistently from our federal officials.
So I can touch the elevator button or open the door and not worry about it anymore.
I mean, look, like what I say to people is like, don't lick the elevator button. You probably shouldn't have done that before the pandemic.
Well,
wash your hands. Keep them clean, but don't obsess. Don't obsess. This is not the main way that this virus is spreading. It's very rare that it spreads that way.
The security video of the elevator button licking was a deep fake, Doctor. Come on, get modern with us. Dr. Ashish Jha, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.